Today I'll be sharing a few interesting cases, CBCT scans. So let's start. In this case, I don't remember all the cases, but then let's see what is it. So we will bring the CBCT to maximum sharpness. Okay, it has a radicular cyst, I guess. Yes. Can you see in front? This is a radicular cyst. It's not that big, small though. But you can see it has caused slight expansion and thinning of the labial plate. You can see it's starting from the right maxillary central incisor, and then it is extending till the lateral incisor. However, it is involving the canine root. For confirming, you can see these other sections as well. As you can see, we can see one section also at a time. I'll just press enter button, and then this whole axial section will be visible. I'm dragging the mouse upwards, scrolling the mouse upwards. As you can see, the canine is also involved. So yeah, the tip of the canine is involved. You can see it's such a big lesion in this. It has also caused palatal plate expansion, and here you can see a little perforation even here. We can see other sections as well. So let's see sagittal. To see this in one go, we can just drag this also. We can change the angle of this section, this line, this transverse line, so that we can see in the sagittal more clearly. In one go, we can see. We can measure the length as we have measured any other length like implant length, the width, the height, the highest width, the highest height usually we do. For the width, we can go back to axial section. In this case, I don't want it to be that straight. I'm changing the transverse line angle. The width, the highest width we can know from this section. As you can see, it's 16.1 mm. We can go back to coronal section. In coronal section, we are not able to see in one go because the maxillary bone is a little proclined outwards. So as we scroll back, we can see the entire. So this is not apt for measuring the width. I measure the width with axial section only. We can, however, measure the length, but still sagittal is more better for the length and the width. Coronal is just for an idea regarding how far it is extended. You can see it's not involving the midline. It's not crossing the midline. There is fracture, so it may be a long time history. There's no root canal or any procedure done. The apex also is closed. We can draw a small curve also, limited to this region. There's a little proclination of this adjacent central incisor as compared to this one. I'm extending the curve just to make sure the other incisor is not involved. So this is about radicular cyst. We can see other or as well. Okay, this is a mixed radiolucent radiopaque lesion or a it looks more like a multilocular radiolucent lesion in the mandibular lower anteriors. As you can see, a big radiolucent locule and then the smaller ones. Since female patient, and usually it happens in the middle-aged. So if she is a middle-aged one, we can suggest CGCG, central giant granuloma. In the mixed lesion, PCD, periapical cemental dysplasia can be suspected, but it looks more like a locular lesion. So CGCG. Okay. We cannot confirm a diagnosis based on CBCT, but at least we get the prominent features which tell us, like as we can see, the small locules which are formed, the curvature of the trabecula because of the pushing of the contents, granular content in the lesion causes this appearance. We can draw a small curve pertaining to this. As you can see how it is appearing in the axial section. We can extend the curve till we see normal bone. Sometimes it's very difficult to see where it is ending. But yes, as we can see now it has ended. And the other bone, surprisingly, there is no bone at all because of most of the time there are osteoporotic changes in women, especially Indian women, because they don't take supplements. Not everyone takes supplements, and even if they are taking, it is just calcium, no potassium or vitamin D. And now, since the awareness is there, hopefully we will not see much osteoporotic cases in women. Now, it's not involving the premolar region. As I can see, the trabecular pattern has become straight. It's very minimally visible. I'm removing the maximum sharpness just to see. But yes, it's not involving. The only thing is the density of the inside cancellous bone is reduced a lot. In the maxilla, we go to the maxilla. The bone appears normal. You can see this, such a big expansion. Usually, there are some lesions and cysts which expand more buccolingually rather than mediolaterally. These are also some points to diagnose and differentiate the cases. So that's about it. We can measure the length, the highest diameter width as we have measured in the radicular cyst. The patient is not positioned straight in this. Wait, just okay. Yeah, this is the 3D appearance. There is displacement of this lateral incisor on the right side, and this is almost straight. So we can see the nidus of the lesion. The start of the lesion is somewhere here. That's why it is displacing the root of this lateral incisor on this side. Then there are some TMJ, lateral perforation, positioning error, dentigenesis. Okay. So I'll show you a positioning error. When you see that the patient has moved during the CBCT, during taking, when the CBCT is taking the scan, the machine is taking the scan, and the patient has moved, how do you know? So what happens is you are able to see a double cortical plate. This and a little bit here, you can see. See, you can see somewhere here, there is a shadow of the cortical plate. So when you see double cortical plates, it indicates the patient has moved during taking the CBCT scan. Ventiviruses. That is here, typical case of dentiviruses. So this is the measurements which I have already taken and the marking, mandibular nerve marking. You can see the radiolucency starting from the cervical region of this impacted third molar. You can see how is it appearing in the axial section, sagittal and corona. Then there is, I want to show you this TMJ, which has typical signs of osteoarthritis. We cannot see the disc in CBCT. So if the patient only has discal changes, only in the disc, the patient can be very symptomatic, very painful, but it may not have any bony changes. So in that case, CBCT, even if it is normal, it doesn't say that the patient doesn't have TMJ disorder because we cannot see the disc in TMJ in CBCT. For that, we need an MRI. But here, apart from discal changes, maybe discal changes must be there because now it has reached to the TMJ. You can see the flattening of the anterior slope and this spike in the anterior border has formed. These are the sagittal sections. You can definitely see flattening and thinning of the superior border of the mandibular condyle as well as sharpened anterior region of this condyle and yes, reduced space, interarticular space. I will show you the other side as well. This is left side. Right side. There is more damage, I guess, here. You can see it is completely, there's a chance resorption also. And you can see this cyst, Ellis cyst, we say, osteophyte appearance, Ellis cyst. The resorption starts with formation of a cyst, small cyst, resorptive cyst actually, in the superior border of the mandibular condyle. This is the axial section. If you want, mainly we understand the sagittal section. So I always elaborate it. We can see multiple sagittal sections. By changing the layout, sagittal multi. You can see there are more changes on the right side than on the left side. So right side is more damaged and maybe more painful. Sometimes it is the opposite way around. Even though there are so many bony changes, but the tissue has healed, so there could be no pain also. The coronoid, this is coronoid, and that one was condylar as I'm scrolling. This is the mediolateral sections actually. So I have drawn a curve like this. Due to the limited FOV, the CBCT was taken only like this. They have focused only one side at a time. And as you can see, this is the condyle. So I have drawn a curve from here to here. And that's how I can see every section. But it is very well visible here as well, sagittal and mediolateral. Here, because of overlapping, we cannot see much in the 3D section. And pan you, there is nothing visible in terms of PMJ X-rays. So that's about it. If you also have some interesting cases, you can share with me. If you have any doubts in any of the case, you can share the CBCT with me for a second opinion. This one is, the root is within the maxillary sinus. You can see this. It has went inside the sinus, maybe while trying to extract. This was pushed inside due to forces, which is very difficult sometimes to see in the IOPA, whether it is inside or outside, because there is so much of angulation errors in the maxillary posterior. And you can see because of this, there is radio opacity, increased radio opacity in the floor of the sinus. The sinus is reacting to this foreign object. We can also see healing lesions before placing an implant. We can take CBCT if in doubtful cases, and we can see whether the bone has completely formed or not. This is also visible in IOPA, but as you can see, CBCT is more precise. It is showing this socket. So it is, we can call it grade 4 variety of bone. So even if the doctor is placing the implant, he has to be just be careful in not putting too much torque and doing it in maybe 2 stage, keeping it closed so that bone is formed more around the socket. I was trying to find anything related to endodontics, but I'm not able to. Usually minor crack in an RCT treated teeth with crown, unseparated cracks, they are not visible in CBCT because of the artifacts, because of the crown artifacts. So when it is nicely separated, then we can see in CBCT, but in that case, it is also visible in IOPA. So many times it doesn't require a CBCT. This is a root canal treated tooth. Sometimes, because of the excessive preparation, it can happen a vertical fracture, but I don't think this case has a vertical fracture. It is very close to the periodontal ligament. I think endodontist must be knowing it better, but it cannot be a cause of pain. I thought it was nicely done as per the CBCT. That's about it. If you have any doubts, please feel free to ask me. Thank you so much. Hope you liked these videos of basic CBCT. Thank you.